Antonia Berylson has just finished a 10-hour shift as a nurse at an NHS clinic here in Sussex. Before going home to her 3 children, she stopped for some food shopping. With a salary of €2,000 a month and faced with rising energy costs and inflation at 11%,
Good evening. Good evening.
she has to make hard choices.
To be honest, it's really, really tough. My children are all teenagers, and my son in particular, he never stops eating. And my eldest is always checking, have you eaten, Mum? Have you eaten, Mum? Sometimes I have to pretend to say, oh yes, I had something at work, because I feed the children at home, but often I don't eat myself.
With Christmas coming, Antonia tries her best to make her nurses' salary stretch.
They are £2 each, or 3 for £5.
Like the vast majority of public sector nurses, Antonia is supporting the strike.
Even with the extra shifts, it's been a real struggle for me and for many of my colleagues. You know, we got our backs against the wall and we voted with a heavy heart, but we just couldn't go on anymore because we can't be the nurses we all want to be. Patients are suffering.
The main nurses' union is demanding a 17% pay rise. Talks with the government are at a standoff.
Nursing pay in the UK is actually much lower than the rest of Europe. Pay central to this dispute, but a much bigger issue personally for most nurses is overworking. We have around 50,000 vacancies in England, and that means the nurses that are left are overworked and they are becoming much more concerned about patient care.
At home, the conversation for Antonia and her partner inevitably turns to the industrial action. He too is a nurse.
The Goodwill Bank is now empty. We're tired of working over our hours and tired of missing out on our breaks. And I think if COVID proved anything, it proved the value of nursing. And it is absolutely the right time to take this action.
Across public services, the situation has turned into the largest industrial dispute since 1979.